welcome back to the life of T and M. Thank you so much for coming back and watching another one of my videos. If you're new here, hi, my name is Mary and I make videos all about nursing. So in today's video, as you know by the title, come along with me. Today is Saturday. I work 8:30 to 5 and I'm an admission nurse for hospice. I work part-time and I help them out about one Saturday a month. And so this is my one Saturday in May that I'm here to help them out. So I just want to bring you guys along my day and let's see how it goes. So I know I already have an admission this morning because I got a phone call before my shift even started that we have one this morning, and it's about an hour away, and this patient is critical and he wants to get home and pass at home, which is why hospice is here, right? To help people die in their home, in the comfort of their home. And so it was urgent, and so I didn't get to prep for this one. So I'm literally grabbing all my stuff in my office before I make my hour drive out there. I'm going to try to read the notes while I'm in the driveway, and I hope the ambulance doesn't beat me there. If he does, we're just gonna figure it out. I have the patient's name, the address, the phone number, very basic information. I see the hospital admission diagnosis, and he's on BiPAP. So I need to go set up that machine before he gets there. So when he gets home, he can just transfer from one BiPAP to the other. So this is gonna be interesting. So come along with me. I'm gonna have to do the consents in the house. I'm gonna have to go over the chart and just make it work, guys. Sometimes this happens. Sometimes you get on the shift, you have 2-3 hours to prep and everything's all filled out. So when you get done, you know, it's easier. But sometimes you have days like this. So I gotta stop talking. I'm gonna get on the road, drive an hour away. I hope I meet the patient there in time because, you know, this is all about patient comfort and I wanna be there for the family and for the patient. And so my number one goal is just to get out there, get his equipment set up and beat him there before the ambulance gets there. So I will update you guys after the visit because I know I'm gonna be in a rush just trying to get there, get in the house and get everything set up. So I'll see you guys after. If you're excited for this video, give it a big thumbs up. Don't forget to subscribe, join my journey because I have more hospice nursing, public health nursing videos coming. All right, everyone, let's go. All right, everyone, that was tough. I just got done. I went in at 9:20 and I got out at about 11, and I came down the hill to like a shopping center. That patient was already imminent and had to set up the machines. I had to give meds. I had to educate, I had to fill out consents and everything. Usually I prep before I go, I know what I'm doing, and this was just, I preach in my videos before, don't ever walk into admission without being prepped, but things happen. Cases come in where you just have to go. Like I said, I knew allergies, I knew name, I knew date of birth, so I can give the 6 rights of medication and be safe. Looked at the med history before I gave any meds, so I got prepared in the house. I just don't like getting prepared in front of the family. I don't know, I just feel some kind of way. But they were very nice, asked a lot of good questions, so I was prepared for that. When you're newer, when the family asks a lot of questions like that, it could be a little intimidating, especially if you don't know the answers. So yeah, if you don't know, you always tell them, I will find out. If you need to call the doctor while you're there, call the doctor. I had to see if I needed to give any different medications. Do I need to order anything different? There was a med I wasn't sure if we should discharge. So your team is there. You should have someone on call on the weekends especially. So yeah, that was a lot. But I left and the family was very grateful and the patient was comfortable. So obviously we did our part, right? So I have here my laptop, my work laptop, and my charting here. I have this cool little tray. It's on my Instagram, and I'm just gonna sit here and chart because I'm hearing I have one more. Usually in an 8-hour shift, the company will give you 2 admissions, and it's right here about 20 minutes away from where I'm at, and I'm about an hour from home. So just pulled over in a parking lot. I'm gonna try to get some baseline charting done because the family may call for a PRN visit and I want the nurse to have something in the chart. So I'm gonna work on that and get as much as I can done until I get that new admit, and then I gotta prep for that and then head over there. So I'm so glad I brought you guys along because it's not a typical easy, oh, I prepped, the admit was easy, I left. This one was challenging. Don't forget, if you have a BiPAP, CPAP machine, call RT. They are experts. They will help you get the machine set up and make sure you have everything connected correctly. So I did that. Good thing I did because the settings weren't what they were supposed to be, so I got to change that. So definitely reach out to your RT team if you have a CPAP or BiPAP. All right, guys, well, I'm gonna get to charting, get some of this information in there. Patient, won't say diagnosis, but you can see the mark. So Always stay safe, stay protected, and I'll let you guys know when my next admit is. All right, guys, see you later. Okay, everyone, so I talked to you at about 11:15. It's 1:20, so it's been exactly 2 hours. I had to actually leave where I was because, of course, my Outlook and Word, Microsoft Word, wanted to update and the service was horrible. So I took off to a Starbucks. It was right down the street. I highly recommend a Starbucks because they have good Wi-Fi. You could plug in your devices. They have music. It's nice and cool because today it's 80 and it's gonna get up to 90. So it was a nice little break, and I actually got all my charting done, submitted it, and now they said that I had one more, but I haven't heard from them. So I'm waiting to hear back from my supervisor before I leave the area and head back home. Hopefully I don't get another one. They usually say that when you're about 3 or 4 hours from the end of your shift, they don't schedule you one because you have to prep, drive over there, do the admission, and then chart. So you're gonna go over your time, right? Time management is huge, and if they give you one late, you can only do so much in that amount of time. I've been with some hospices where they don't really care. My current employer tries to stay as close as they can to the end of your shift. So I'm gonna hang out here for about another 5 minutes. If I don't hear from my supervisor, I'm gonna head down the hill and get back home. So sometimes you have those days where you just have to be out here in the field, sit in your car and chart if you have good Wi-Fi, or go into like a Starbucks and chart and get everything done. So I would say don't get into hospice if you don't like being out in the field, out driving in your car, because this is what it's about. Whether you're a case manager or an admission nurse, you're gonna be driving. So get comfortable, have your car essentials, and just prepare your day because anything can happen. I know earlier they said that my admit is supposed to be at a hospital. I'm supposed to go evaluate them, which is about 20 minutes away, but they're waiting for the referral, and it's been 2 hours, no referral. Sometimes it doesn't happen. The facility says they're gonna send the referral and it never comes through. It comes through late. So, you know, with hospice, you really just have to roll with the punches. Okay, well, I actually just looked at my phone. I got a text from my supervisor. They said yes, to go ahead and go down to the hospital and evaluate the patient. So here we go. Hey everyone, so I wanted to come back on here and talk to you now that I kind of got settled. So I am on my way to a hospital, like I said earlier, to go evaluate a patient because they're kind of on the fence about hospice. So it's going to be a consult / evaluation. One, is it something that they want? And two, do they even qualify? Or could they possibly want to go with palliative care, home health, etc.? So I am making my way up there now. ETA is about 20 minutes, 18 minutes about. So I've never been to this hospital. It's kind of in a remote location, but that's okay. I go to some of these places for the first time. So I got my GPS on. I am heading up there now, and I am going to just take my LCD guidelines, which for our hospice company, we have a booklet, and it has all the hospice diagnoses and then what they need to qualify, such as if it's cancer, are they stopping treatment? Did it metastasize? Do they no longer want to pursue treatment? Do they have a decrease in their ADLs? So it's nice because it breaks down what a patient needs to meet. Now, if you're ever having questions, because I still do, I still get confused with what diagnosis do I use and do they qualify, call the doctor. I think that I underutilized them when I first started because I'm like, no, I should know this. I'm gonna sound stupid. Even if you do, it's okay, right? Because one, you have to get a doctor's order regardless, but sometimes you're on the fence between maybe like a lung disease or a heart disease diagnosis as the primary hospice diagnosis. So definitely loop in your doctor. Also, if you're at a visit and you have questions, step away and call. Today, I definitely called the doctor to go over the medications, the comfort pack with the family, and I went back in to see the patient before I left, and I noticed severe shortness of breath and just had a rapid change in condition. And I had all the meds, I had his oxygen maxed out, and so I called the doctor right before I left just to see if there's anything else I can do. Based on his diagnosis, his presentation, the doctor had said there's nothing more we can do, but of course to keep him comfortable. So we did increase some of his meds. I administered meds while I was there to get him comfortable before I left. And also, if the patient needs medication while you're there, it's good to administer them so that the family can see you do it, because they're going to be ultimately responsible for giving the patient the medication. So they call it return demonstration, right? You watch me do it and I watch you do it. Also, if you identify that the patient has any needs and you're unable to fulfill them based on the maybe equipment you have or the medications you have, always have a nurse follow up after you leave. Specifically, I'm an admission nurse only, and so I bring supplies with me, but every patient presents differently and has different needs. Sometimes you may not have that 16 French Foley catheter. You may not have the right size briefs in your trunk. You may not have a certain wound dressing. And so you write down what the patient needs, you call your on-call staff, and you ask them, can you bring it? Is it necessary that they need it today? Can they wait till tomorrow? Can they wait till Monday? You have to assess what the patient needs and in what time frame. I'm sure you can probably see how rural it is right next to me. I'm actually in California. I don't live rurally, but just an hour, hour and a half going east of us, you get right into these beautiful hills. So nice out here when the weather is nice. When you're in the daylight and it's not raining, it's not snowing, it's beautiful out here. But once you get to the nighttime and any weather changes, can be a little scary out here. Well, I just feel relieved because I was able to finish all my charting for the first patient, called in the medications, all that. And actually about an hour after I left, I did get a call that he did pass. When I left, he was comfortable, so I'm happy we were at least to be in his life for a little bit before he transitioned. If an admission is close to me, I will go home and finish my charting. If I have 2 admissions, I will try to do them back to back and then get home and just chart the rest of the night. And if I only have 1, obviously just do the 1 and go home, right? Today was a little bit different because I'm about an hour away from home. I like to try to stay up in this area in the event there's another one out here. I don't want to drive an hour home and then get called to drive another hour. So today worked out because I stopped by down the hill, I charted, and then my supervisor sure enough reached out and said, there's an evaluation at a hospital 25 minutes where you're at, can you stay up there and do that? Of course, I don't want to have to go back home. And I'm on the clock for 8 hours, right? So it is 1:37 right now. I should be there at 1:50. I'm gonna go into the hospital, find the patient. Who knows how long the conversation will take. And then I should be done. If this doesn't turn into an admission, then I will go home. I will type up if this patient qualifies or does not, so the team is aware and it can move forward after that. And then my day will be done. So it will be interesting to see what time I get home. You guys are gonna find out along with me. So for the second one, I have no paperwork. I have a diagnosis and that the patient is on the fence. So it's just funny how today worked out. I wanted to bring you guys along with me thinking everything was gonna be fine and dandy, but I think this is cool for nurses or anyone who's interested about what does a typical Saturday look like for an admission nurse. I don't think it's typical because usually my admits are mapped out, they're ready for the day, and I can pre-prep and get my paperwork together. I think this is the first time where I've worked a Saturday and everything is just like, just do the work as you go. But I feel like in those moments, this is when you learn because you're uncomfortable. It's not the usual. You may have a diagnosis you've never seen. You maybe had to set up a machine that you haven't had to set up in a long time. But these are the moments where you lock in as a nurse and you remember these moments. You grow from these moments. Uncomfortable moments make you grow. So as much as you may have anxiety about it, reach out. I probably text my supervisor all day today. On a typical day, I don't reach out to anyone because it's pretty standard and I know what I'm doing. But today it was a little bit of a challenge and that's okay. I reached out to my supervisor. I said, I'm so sorry I'm bugging you. She said, no, you're not. You need those kind of people, right? Even if you don't feel they're supportive, just to cover yourself and to learn and for patient safety, reach out. Reach out, reach out. And like I said, your doctor's there as well if you need clinical guidance. Sometimes you need administrative guidance. So depending on the type of guidance you need when you're out in the field, utilize your resources. They are there for you. And as an admission nurse, you don't carry these cases. You see them, you admit them, and then you're done. So you want to develop the best care plan that you can so that the next nurse coming on can just pick up and continue supporting the patient. Well, I think that that's enough talking, and I'll see you guys when I get out of this admission. Bye. Well everyone, I just got done. It took me about 45 minutes. I went into the hospital and saw the patient. informed him what our services were about. He was agreeable but wanted some time to talk to his family, which was fine. So I talked to his nurse, gave her an update. When I get home, I'll write up a note to my admit team to let them know how he qualifies, that he's interested, but he would like a couple days to talk to his family about it. Maybe an admission Monday, Tuesday, we shall see. So I'm so excited my day is done. It is already 2:30. I'll probably get home at 3:30, type up my email, and potentially be done by 4, hopefully. And then I'm off the clock at 5. All right, everyone, well, that's it. Thank you so much for coming along with me. I hope you guys loved following me. If you want more of these, let me know. And if you have any other questions, want me to make any other videos, let me know. I have one coming up that is an admission nurse versus case manager. Which one's better, pros and cons? So stay tuned. All right, everyone, have a good day. Bye.